I recall, gosh, almost 20 years ago now, when I got onto the oncology ward, and Dr. Scharfman was there as the senior physician. And I remember seeing these patients that were getting immune therapy back then and remembering how potentially powerful those drugs were in helping the patient's immune system see these cancers and knock them out. In fact, I still have one of those patients in my clinic whose cancer appears to be gone 20 years later. So the immune system is a tremendously powerful thing. And when it zaps cancer, that's exactly what we ask it to do. But sometimes it does not. Sometimes it misses the mark and it hits something else in the body. So our senior nurse practitioner, Megan Schallenberger, is going to talk to you today about what happens when the immune system attacks a part of the body we would rather it not.
Hey everyone, I'm Megan. I'm excited to talk to you about immunotherapy toxicities today. So Dr. Scharfman went into this briefly in his talk. He's discussed also the success of immunotherapy, but we also need to discuss some of the side effects that come along with the successes. So just briefly to go into what are immune checkpoint inhibitors. Immune checkpoints are a normal part of your immune system that act as a brake, preventing an immune response against healthy cells. So, in somebody out there without cancer, an immune checkpoint failure could be an autoimmune disease like rheumatoid arthritis, psoriasis. There's a whole laundry list of them out there. The same immune checkpoints prevent your immune system from attacking the cancer. So I don't have a pointer here, but you can see that there's a tumor cell, and the tumor cell holds up, in this case, a flag called PD-1 that shakes hands with the T cell. And that prevents kind of the immune system from saying, hey, you are the bad guy, I'm going to not attack you. So these immune checkpoint inhibitors go in and actually block that handshake from occurring and hopefully allow the immune system to attack and kill the tumor cells. So basically, the immune checkpoint inhibitors are drugs designed to release the brakes, allowing your own immune system to destroy cancer cells. So as discussed, sometimes we miss the mark. So what can happen when you release the brakes of your immune system? So we need our immune system to go everywhere in our body because we need it to fight infections. We also want the immune checkpoint inhibitors to work everywhere in our body because we want it to attack the melanoma or cancer wherever it may be, whether it's the brain and the skin, the bones, etc. Meaning that when we release the brakes on your immune system can go everywhere and unfortunately can start attacking an organ we don't want it to attack. So I like this graphic because when patients are coming in saying that they have a new symptom, or we are seeing a new abnormal lab value, or we are finding an abnormal exam finding, this photo is going through my head about where the immune system goes and where all the itises or inflammation can occur that can then lead to damage to the organ. So there are a few common places. Your skin's your biggest organ. So dermatitis or inflammation of the skin resulting in rashes or other skin conditions is one of the common things we see. Also colitis, which would be inflammation of the bowel resulting in diarrhea, bloody stools. Sometimes it can impact the upper bowel, so nausea. The thyroid is particularly susceptible to immune system inflammatory response. And so we monitor your thyroid very closely. And then there are some really rare side effects that we see. Luckily, the organs that seem to be impacted the least are the most imperative organs, like your heart. So inflammation of the heart is a very serious side effect. Luckily, it's not very common. And then there's side effects that I have seen maybe once in my 10 years of being here that are very rare. So when I'm seeing people on immune checkpoint inhibitors, every single time one of your oncology team is seeing you before the treatment, this is kind of what's going through our mind when we're thinking about what are the side effects that may be happening. So how do we recognize the side effect? One is we ask you to report any new side effects or symptoms to your care team. We don't know something's happening unless you tell us it is. Routine labs. So anytime somebody's getting an immune checkpoint inhibitor, they're getting routine blood counts, kidney, liver, and thyroid tests. If you have a symptom that we think is not being picked up on the routine labs, but you're coming in here saying, I have joint pain, we might order additional tests to evaluate specific symptoms. And then you're getting exams prior to each treatment. We're monitoring your blood pressure, listening to your lungs, often looking at your skin. So then, say we think you have a side effect from immunotherapy. Your immune system has now attacked an organ we don't want it to attack. In our minds, we're thinking, is this life-threatening or is this not life-threatening? Or could it be life-threatening quickly? So not life-threatening would be a low risk, but can negatively impact your quality of life. So it could be an itchy rash. It's not everywhere, but you're very itchy. The itching's keeping you up at night. That's not going to be fatal. It's not going to put you in the hospital, but it sure is impacting your sleep. Arthritis is another one that we see where people have some joint pains. It can make kind of moving around a little more difficult, but it's not going to, imminently impact your become fatal often. And it typically allows us to continue immunotherapy with supportive care. Topical steroids for the itching, some antihistamines. And then we go to potentially life-threatening. And some of these, like dermatitis, so skin toxicities, can kind of go in between both. So somebody with a little bit of itching, it's annoying, versus somebody with a rash all over their body, life-threatening. So we're really thinking about where are we on this spectrum. Life-threatening, is think you have inflammation in your lungs and your oxygen levels are down. And this requires really early recognition, patient communication, and timely evaluation. We're often holding immunotherapy and administering immunosuppression, meaning we need to pull back on the immune system. We want the immune system to attack the cancer. But in this case, it's attacking an organ that could be, potentially fatal. Your oxygen levels are low. Your liver enzymes are up, meaning your liver is inflamed. And so we need to pull back on that immune system. So how do you manage a side effect? So one is, back to the previous slide, is how serious is this side effect? And there's some where it's black or white. This is inflammation of your heart. This is inflammation of your lungs. This is inflammation of your liver. Could become potentially life-threatening. Even in patients who we can see the tumor on scans, they have liver metastasis. We are holding therapy because at this point, this immunotherapy is causing serious damage. And then there's other side effects that we think is, you have joint pain, which is just a common one we see and talk about with patients. And you have a big liver tumor that we can see on scan, or you have a big tumor that we can see. How aggressive are we going to be? Can we get by with a little Tylenol? Can we, and then continue immunotherapy because we have this big tumor to attack, versus somebody who we are giving immunotherapy in the adjuvant setting, meaning we have removed your tumor, as Dr. Lang and Dr. Scharfman have discussed. We think it's at high risk that the tumor can come back or that the melanoma might be out there, but we don't see anything on scans. And so how serious is the side effect and what we do about it really depends on, is it life-threatening? How much is it impacting your quality of life? And what is your tumor burden? Is there a lot, is this tumor imminently life-threatening in the coming weeks to months? Or are we not really seeing on you on anything on scans and there is a potential that you are cured already? So supportive care, topical steroids for itching. Some people get dry eyes, dry mouth, dry eye drops, mouth washes, mouth rinses. It really depends on where you're having the side effects. The life-threatening requires holding a therapy typically and starting immunosuppressive drugs. The caveat here is endocrine toxicities. So in patients where they have their endocrine system is impacted, meaning that the immune system has attacked your thyroid, where your thyroid levels are off, your immune system can attack your pituitary glands. So you're no longer making cortisol, and cortisol is your fight or flight hormone. It's what keeps your blood pressure up. It's what keeps you going. If you don't have enough cortisol in your body, you are not functioning. Another endocrine toxicity that we see, although not quite as common, is a pancreatitis. Immune system attacks your pancreas, causing an insulin deficiency. You're no longer producing insulin. So it's like a type 1 diabetes. Also, life-threatening. But in these situations, we can actually just replace the hormone. We can give you some hydrocortisone, we can give you some insulin, and then we can move on with immunotherapy. And then close monitoring. Okay, so what else should you know? So there are side effects that we see in oncology all the time. In the melanoma clinic at Hopkins, we give immunotherapy multiple times a day to multiple patients. So we have seen a lot of toxicities. We are, depending on the provider, we're pretty comfortable with managing some of the common side effects, dermatitis, colitis, but we often have to bring a subspecialist involved into the picture. In the 10 years I've been here, when I started here in 2016, we were giving a lot of prednisone steroids for a long, long time. So patients would be on, for colitis, inflammation of the colon, they would be on steroids for several months. We would be continuing it for a month and then increasing the steroids again. And over the past several years, we have really evolved in our treatment of these itises, these immune toxicities, and we've started giving biologics sooner, so we can get patients off prednisone and sometimes even then be able to continue the immunotherapy in some cases. So we have actually relied more and more on subspecialists, including rheumatology, gastroenterology, some are more dermatology, to help us start some of these additional, more targeted immunosuppressive agents to more effectively treat the side effect and allow us in some cases to not cause as much immunosuppression and sometimes continue the immunotherapy. Hospitalization is sometimes needed. There are some side effects where we think that this could be life-threatening in the next couple of days. We need to bring you in. You need IV steroids. We need to monitor you closely. You need a specialty referral that day. One of those is, without question, myocarditis, inflammation of the heart. We are bringing people to the hospital. I think colitis is one of those things, it's just some diarrhea. And sometimes it is just a little diarrhea, a couple times a day, start a little steroids and you're doing okay. But sometimes the colitis can actually become life-threatening, multiple stools a day. You could have perforation of the bowel. So it really is nuanced, the side effects really can range from something mild to something where we need to bring you into the hospital. Side effects can be short-term or long-term. So is holding immunotherapy enough? One dose study when nivolumab was still in trial back in the day, over a decade ago, they measured how much of that drug was in your system over a couple of months. So when the drug nivolumab was given in your blood serum, the nivolumab exited your system within a couple of weeks. However, this is not about the nivolumab circulating in your blood, as we discussed. This is about the drug, the immune checkpoint inhibitor, attaching to your T cells. And they found that after one dose of drug, your the immune checkpoint inhibitor, nivolumab, was attached to your T cells at the same level without decreasing for at least 60 days. Meaning, one, it's okay to hold the drug for a couple of weeks while we're working on, is this a potentially life-threatening side effect or not? The immune system, this stays in your system for months and months and months, even after just one single dose. It also means that holding immunotherapy is not enough. We have patients that 3 months, 6 months after their last dose of immunotherapy are still experiencing side effects. There are some rare cases where people are still seeing our rheumatology team 5 years after stopping immunotherapy to still manage their inflammatory arthritis. So it's good in the fact that your immune system remains active against the cancer just after a small amount of this drug for a very long time. It's bad in the fact that holding immunotherapy is not enough often in managing the side effects. Experiencing a toxicity isn't always a bad thing. There is some evidence, it's not a causation, but there is a correlation between people who have a side effect also seem to have responses. That's not always the case. But I like to see somebody coming in with a little itching after their first couple doses, a little bit of a little bit of mild rash. It means your immune system's active. It's doing something. It's woken up. And then, so my last bit is kind of knowing your part. And I always tell patients it is their job to report a new side effect. If we see, every 3 to 4 weeks on average, sometimes drugs are given every 6 weeks, which is a bit of a long time. So we ask you to contact us when a side effect happens. Side effects tend to snowball, meaning they start off mild and then they get worse. So if you have a new diarrhea, you woke up with 3 episodes of loose stool before noon, or even just 1 episode of diarrhea for a day for the past 3 to 4 days, that's something to call us about. Don't wait till we see you 3 weeks from then. Because it's something that could get worse, or it might not be related to immunotherapy. It might be an infection. We could have kind of worked it up, treated it, and then allowed you to continue immunotherapy versus kind of being behind the game. So when you have a side effect, let us know. It is our job to know what to do about the side effect. So your job is to report. Our job is to know what to do. So save your clinic phone number. We often give out, most clinics, at least at Hopkins, we give out a folder. Papers get lost. I tell people to put the clinic numbers on call, daytime, nurse triage in their saved phone. Know when to use MyChart. This is an increasingly common form of communication. It's great. We are typically at Hopkins very quick at responding to it, but there can be delays. So if you wake up with a mild itching, it's just a little bit annoying, probably good to send a MyChart message. If you wake up and you're having 6 episodes of diarrhea that morning, that's probably a time to give our nurse triage a call. When do you call in the evenings and on weekends? I tell people if they have something where they are worried that they have a side effect that could be potentially harmful, give us a call. We have a Hopkins on call, evenings, weekends, holidays. And what to do if you go to your local hospital. So basically, whenever you call a medical clinic and they say, is this a medical emergency, call 911. So if you cannot breathe, if you are suddenly confused and you don't know who you are or who the people around you are, if you're having chest pain, you call 911. And then you contact us, or you have a family member contact us that you are going to a local hospital. I think it's often helpful to have, there's immunotherapy wallet cards, but you don't always need to have that, just to have the name of your oncologist, their triage number, and what drugs you're receiving. The one thing that's important to know is even if you got, which we talked about short-term or long-term side effects, that even if your last dose of treatment was 3 months ago and you're having a new side effect, again, this drug can stay. So if you're going to the hospital with something that's concerning, it's important to let the team know at this local hospital that, yes, you're receiving cancer treatment. This could still be a side effect.